to our latest episode of Wellbeing Wednesdays, the National Council's virtual series on healthcare. Today, National Council for Mental Wellbeing President and CEO Chuck Ingoglia is joined by National Council members Callie Cripps with Aurora Mental Health and Recovery, Andrew Schmidt with Gadenzia, and Darren Dunham with Trilogy Inc. In this episode of Wellbeing Wednesdays, our panel will discuss the benefits and challenges of artificial intelligence, how to incorporate AI into your daily workflow, and how to use AI to improve operations for mental health and substance use treatment and care organizations. Now, please welcome National Council CEO Chuck Ingoglia.
Hello, everyone, and welcome to our great discussion that we're going to have today about how technology is being used in new ways in behavioral healthcare. And thanks to all of our panelists, Callie, Andrew, and Darren, for being with us today to share their perspectives. Last summer, I had the opportunity to be at a healthcare conference with some of the biggest players in healthcare, people from very large health plans, hospital systems, other parts of healthcare. And the only thing that people could agree on is that artificial intelligence held a lot of promise for impacting the way healthcare would be delivered in the future. And there was a lot of discussion about what that might look like. Since that time, as I've gone to different conferences around the country, I've seen all these different vendors emerging in the behavioral health space who are offering artificial intelligence supports for behavioral health organizations. So today's conversation is to try to take all that kind of stuff that's happening and look at it from the perspective of National Council member organizations. And so that's what we want to do. We want to hear how are organizations not just thinking about it, but how are they using new technologies? So again, thank you to our three panelists from around the country who are going to help us have this discussion today. And I know that you're at different places, right, in your journey of using artificial intelligence and that technology. And that'll be part of the fun too. And, I'm going to we're going to have a series of questions that we're going to talk about, and we'll give each of you an opportunity to answer those questions. But hey, isn't the best part of any kind of these presentations dialogue between panelists? So, make sure that we don't forget that as well. Okay, does that sound good? So let's get started. I'm wondering if each of you could take a minute to help set the stage. What kind of led you to begin this exploration and implementation? What were some of the problems you were trying to fix, and kind of how do we get here? So maybe we'll have ladies go first. Callie, do you want to take a first crack at this one?
Yeah, I would love to. AI has been around for years, or not years, well, yeah, years, decades. But recently the environment around that is changing, right? And so we've been watching over the past several years how these conversations have been bubbling up. But we're also very cognizant of some of the historical concerns around, are there biases that we need to pay attention? Is it a solution that can only do one thing? As we keep in mind that, as a community-based center, we have limited funding, and we're looking for solutions that are really going to add a lot of value across the board. And so as we started to look into why would we embrace AI solutions now, we started looking into the evolution of this, right? Are people providing transparency into the models behind these AI solutions? What is the ongoing perspective? Is there clinical insight into what's going on if we're going to use a clinical-based tool? And then also the financial impact and aspect and risk around that, because we need to make sure we're using our resources really wisely. And so we decided to kind of take that leap within the last year, because we felt like at this point we can have input into what's going on. We can see how the data is being used and work with our vendors to make sure we continue to have that transparency. And so it seemed like a good time to take a financially responsible risk in finding solutions that can make the work experience better for our staff.
And so, Callie, as you started on that, kind of thinking about it, were there particular challenges that you were trying to address in your agency that you thought this could be helpful?
Yeah, absolutely. Our staff have so much going on on a daily basis, and our caseloads are really high for our staff, and the documentation requirements are even higher. And so we started looking for solutions that can make the day-to-day experience of our staff seem less stressful, right? We don't want you at home doing work. We want you with your family or your friends in the evenings and the weekends, as well as still maintaining our ability to meet all of those regulatory requirements. So it was kind of the combining of how do we find a solution that helps us get more time focused directly on the client without this looming documentation kind of burden hanging out in the background.
Well, that sounds great. And Andrew, I see your head nodding, so I'm wondering, do you have a similar story?
Callie, sharing about the history and kind of the lead up to looking into AI. Ours is not tremendously different. Definitely the documentation burden was early on the significant motivator. We, from a Godenzia perspective with our leadership, they were seeking to find ways to leverage technology to ease exactly that documentation burden with our staff. We started with the AI journey around the time of the early time of the COVID pandemic. So what that then also quickly translated into is staffing issues. So our ability to, again, try to work as efficiently as possible, and also from a retention and recruitment perspective. So, seeking to find that work-life balance, being able to lead with some of those resources and really offer the staff that we were seeking to hire and also retain that we do understand, we fully empathize in all of the different directions that you get pulled into. And we as a system really are trying as best we possibly can to afford you the necessary tools to be successful in your role.
Makes a lot of sense, Andrew. A couple things there I'll come back to, but let's give Darren, a chance to answer the why question as well. So welcome, Darren.
I can only echo what Callie and Andrew had to say. The biggest why has to do with the quality of the services that we're providing in Trilogy, being able to spend more time actually with the client and doing the work that drives us to be in this field in the first place. There's a necessary evil to documentation, and there's not enough time in the day to be able to provide the kind of supports that the clients need and still get that documentation done. Having worked in the field and having to deal with those issues, I often find myself after hours catching up notes and having very little personal time. And what these types of initiatives have been able to do, it frees me up personally to have more time during the work hours to spend with the clients and to also have my own personal time, as Andrew mentioned, the work-life balance, so that I can do other things and not feel so overwhelmed.
I won't tell you, ages ago when I used to do clinical care, I would do the notes like weeks after. I would, so should I admit this now? But we've come a long way since those days. So Darren, you've been actually using the technology. Can you talk a little bit about how is it actually working in like your day-to-day experience? What exactly does it do?
Well, what it's been able to do is dramatically lessen the amount of time that I would spend to write a quality note. there's a requirement that our notes are done in a timely fashion for insurance and billing purposes. You want to have notes that are fresh, that are relevant, that, as you just indicated, a note that's done 2 weeks after the after the event isn't going to quite accurately reflect what actually happened. So to be able to provide those kinds of quality notes and to provide the kind of care you need to be able to do, note writing time is greatly reduced. My notes, maybe a quality note might take 12 minutes to write, sometimes 15 minutes to write. And using this product, we've been able to reduce note writing time to as little as 4 minutes, 3 minutes, even 2 minutes in some instances. And not just to put something together just to push it through, but quality notes that have been able to more efficiently carry the message of what actually happened.
Thank you. And so maybe Andrew, so what I heard Darren talking about is the ability of an AI tool, it sounds like, to summarize the clinical exchange that happened. Is that how you're using AI at Gaudenzia?
Yes. So our AI, we're the most consistent service that we've used it for has been in individual sessions, and probably the four biggest ways that we've utilized or benefited from AI is one with the documentation. So as Darren was just mentioning, and in our experience, it provides the capacity. So we'll get automatically generated suggestions for the progress note, and where that becomes, and our experience has been, again, similar to Darren's, but it allows for the clinician, the way I generally describe it is not start kind of with a blank sheet of paper. So it gives you the foundation, and your comment of working kind of 2 weeks behind, definitely I was in that boat. And oftentimes then, if you have a full schedule of sessions, looking at it, it's kind of like that first step is the most critical, but the AI gives you the bones or that foundation to operate off of, and then you're able to edit it or adjust it and kind of finesse it. So it really does become a much richer, robust note, with less brain power expended on the part of the clinician. The other thing, which is fantastic, is the capacity to track or show evidence-based interventions that are being used. That's a huge resource. I mentioned the staffing, and then another way that we've really seen a huge benefit from it is with training and supervision. So it provides us a phenomenal opportunity in terms of being able to essentially enjoy that direct observation without having to physically be present during the course of the session. And from a supervision standpoint, that's an incredible asset, again, from a retention, from a training and development perspective.
Well, thank you. So maybe Callie, does this sound similar to how you're using it in your agency? And if so, then I have a couple of questions I wanted to pick up from Andrew's comments.
Yeah, absolutely. It's very similar. The only thing I would add is we have a secondary tool that's primarily based for real-time live guidance as you're walking through the health record system to help our staff remember what they have to do without going to, your intranet or other resources to see what's going on. And that tool is providing a smaller adjustment to workflow, whereas documentation in the EHR is going to be built in a certain way, but that doesn't necessarily correlate with exactly how you'd have the best clinical conversation with the flow. And so we've been able to use some bots to modify the way it prompts the clinician to ask questions to flow better with a natural flow of care in a therapy session. And then that automatically moves that information into our health record, which is just a different way of removing some of that burden for our staff related to actually getting the information into the system.
All right. So wow, you guys have said a bunch. Let me just see if I got this right. Right. So I think, Darren, you've described one of the things that you've experienced is that the AI tool listens to your session and then prepares a summary note that the clinician can modify in order to check for, is it actually, saying the right things that I really do want to say. It's really making sure that we're connecting back to the, kind of the treatment plan and that it all makes sense. That sounds like one of the things I heard you guys say. But then I heard some other cool things, right? That it's, Andrew, you talked about your kind of connection to evidence-based interventions. Do you want to unpack that a little bit more? And then Callie, I have a follow-up question for you.
Sure. So we actually have the ability, and if I take us into the weeds for a second, so the AI software that we use, there's 3 different platforms or options with it. The most in-depth or sophisticated will actually provide us a transcription, and then it'll show you the evidence-based interventions that you utilized and where in the session that they were used. And specifically with motivational interviewing, it'll then also offer you an assessment on open-ended questions, closed-ended questions. Did you frame them in the right context? It'll talk about clinician and client talk time. So it really does afford a wealth of data and analytics to, again, kind of evaluate the session. And we've seen counselors use it for their own insight. We've had counselors who actually will review the session with the client to kind of go back and say, like you were focusing on these particular topics over the past several weeks. And then, as I mentioned, from a clinical supervisory perspective, it's a phenomenal resource. If a counselor goes to a motivational interviewing training, then in the follow-up weeks, we would have the ability to look, are you utilizing MI effectively? Or if a counselor is having a difficult time with a client, they can go to their clinical supervisor and say, can you review the past 2 sessions that I've had with client Johnny? It doesn't seem as though we're clicking, or I don't really know if we're getting to our treatment goals. And instead of the supervisor having to then go sit in the sessions, it's literally at their fingertips to go and kind of peek into that session.
And then, Callie, I was just curious about, you were talking about this idea of prompts and bots, and I think I have like a vague idea about what that might look like. Could you describe that a little bit more and how that works?
Yeah, so best way to describe it is if you have your screen in front of you, this training tool kind of sits on top of the screen. So outside of us telling you it's a different software, you really don't know the difference between the health record itself and this add-on kind of software. It just sits right on top of the screen. And then you have kind of a dock, so you can apply something on the side of the screen that provides you this note content or training information, depending on which avenue you're looking at. And then it puts that fully in the hands of our staff to decide if they want to move that information from the doc into their note. Because, right, these are tools that we want to assist our staff with. And so for the purpose of how the screen looks, it looks like one screen to them, and they have full control over what they can move over and where. And the bots are pretty cool because they kind of look like the chat on the side of a Zoom or a Teams meeting where you're talking back and forth, and one person happens to be the computer and one person is you, and you're logging the information. So it's really interesting how far we've come, that it can just look like it's all part of one system, even though it's not.
And I guess the content of that then is, right, it's listening to the session and able to support the clinician to make better decisions. Is that the idea?
Yeah, absolutely. It kind of goes along the lines of what we've been hearing for years through meaningful use, clinical quality measures, as it's evolving. It's giving them the information that they're pulling through the session that we all need, that we all know that we need to have. But when you're in the middle of a session, you might forget something that happened at minute 1 versus at minute 58, because we all joke about, what'd you have for lunch today? I don't remember. Well, how are you going to remember everything you did with your clients at 6 sessions a day. That's just an unrealistic expectation for anyone. And so just putting that front and center and kind of relieving some of that memory burden is really exciting.
Yeah. So Darren, I see you nodding your head. Is there anything you want to say?
I'm picturing what it is that we actually do. It's very similar in the way, but the one thing I do want to point out is that we've been using this technology for about a year now, and I am really impressed with the growth of the technology. When they talk about augmented intelligence, it's like the language output from the tool has improved and it gets better over time, and it is able, the note quality has gotten better over time. The output from what we're putting in when we're selecting the interventions, the response that it is giving us back has just been phenomenal. Just to see this unfold has just been so welcome throughout our organization. It has helped boost morale. I just can't even put a number on that. You know, it's just been great.
Well, gosh, you anticipated my next question, which was going to be like, how are people reacting to this, and what's been what's been the experience? Has it actually done what you thought it was going to do? Let's start there. Let's keep with that. So, Andrew, I saw you nodding your head. So you have the similar kind of thing. The things that seems like you're getting what you expected, and maybe it's even getting better.
Yes. So the simple answer is yes. I think that I 100% agree with what Darren was sharing in terms of it is incredibly fascinating. It's also empowering or motivating for the staff to know that the more they use it, the better it gets. From a cultural perspective, Godenzia is a very large system. We operate in multiple states. Every level of care from a drug and alcohol standpoint. So not every single clinician is going to come into daily or even any contact with one another. But this really is an exciting initiative that the whole agency can buy into, and when we're able to share progress, or we kind of give within like the internal newsletter of the number of sessions that we're doing, or if there's another set of staff that got trained. It is exciting, and there's a significant amount of counselors that feel good that they're a part of it. But just real simple things that I could offer. As Darren mentioned, we went from probably 10, 11 minutes for an individual session to now our average is below 5 minutes.
That's documentation time?
Correct. Yeah. We've seen, so this one is probably, and maybe it's from a personal standpoint, but our average median time for the submission of a note is 20.3 hours from the time of service. So when you talk about weeks out after a session, in all honesty, we are impressed without the AI. If staff are doing their notes within 48, 72 hours, we feel pretty good about that. But if you're less than 24 hours from the time of the service, it's unbelievable. I mean, it's incredible in terms of the efficiency, in terms of the accuracy of the note, and also the staff not getting overwhelmed that I have, I'm 20 notes behind or anything like that. They really do feel so much better that I do my services, I'm able to complete the documentation, and then I could go home, fall asleep, okay, that I don't have to wake up and I got this hole that I have to dig out of. Another metric that we're super excited about is we've seen a 35% increase in evidence-based interventions for LEO sessions. Now, I'll quickly follow that up with somewhat of a disclaimer, because again, when they are using the AI, they get excited about that. And I believe it's almost like, like if you're a teacher and you have your supervisor that's doing like the in-class observation. So they really do, they want to bring their A game. I think they understand that, it's something fresh and new. But we're almost 3 years into this journey, and that really has held consistent. So I think, we're gonna be able to live at that, and seeing such a significant improvement in the quality of care, of course, is a win for everyone.
Yeah, I think they call that the Hawthorne effect. And I always thought, if I get the outcome that I want, I don't care what it is, as long as we're getting, the change that we had hoped for. So Callie, we talked earlier about like the why, and that we talked a little bit about the what. Now, are you finding that implementation has met your expectations or exceeded? Not like what's been your experience?
Yeah, I think I have to echo a lot of the things that Andrew said, right? We're seeing what we set out to see, which was that initial reduction in time for our staff to be documented, because we're hoping that that is a direct translation into what they're able to do in their evenings and weekends. And for us, we have thus far taken an approach of a word of mouth kind of model to get things going, because we feel like it's really, really powerful if your peers are telling you that it helped you. We can tell you on the administrative side, we think this is going to help you. We can give you the metrics that kind of demonstrate from the tools perspective that it's helpful, but nothing's ever going to beat your coworker sitting down the hall doing the same thing, saying that, hey, I got to leave at 4:30 today and I wasn't here until 6 o'clock because this tool is really helping me. And the other thing I'll add, because I know when we were looking at this, one of the things that kept coming to my mind is like, oh my goodness, what is the technological lift on the back end of this from the IT department side? Because any project we bring in, we have to evaluate, well, what's that going to take away from the work we already had planned to do? And one of the cooler things from the tech side, I think, is also reducing some of the burden on their workflow. So this is an embedded tool that doesn't need, a 3 to 6 month lead time working with the health record vendor to get it up and running. We were able to get this going with one IT project manager, and that just really speaks to the other benefits of this that allow our IT teams to keep working on the other things that we're going to provide value for our staff while they get to use this other tool, which I just think speaks to the comprehensive approach of we're looking to reduce burden all across the board and keep moving the ship forward. So it's really been cool to see how this is all, playing out.
So I'm curious, I know one of the things that is tough sometimes is around supervision is just that there's so many other pressures, right, around productivity and so Andrew, you've talked a little bit about kind of the supervisory experience that all of a sudden now supervisors have much more insight into what's happening clinically. I'm just wondering, Callie or Darren, is there anything you want to say about that and what your experience has been?
I can add a little bit here we, at a very similar time to kind of pushing this out, we really did a big push on productivity, and we were able to see the productivity kind of numbers increase fairly substantially at the same time as saying, hey, we've got to make a push here, and we're providing a tool as we help make this push. And we've been able to see a lot of improvements across the board there. And I'll let Darren speak more to the supervisor side of things.
Have an actual situation where a new employee was onboarded, started on my team, and was having quite a bit of difficulty with note writing. She was just experiencing so much trouble with putting her words together and being able to use the golden thread to tie everything up and was just struggling. And then lo and behold, she got this product and was able to cut down her lag time. She was able to put together quality notes. It was as if the program was able to just miraculously turn her into a well-seasoned clinician. And for someone who had experienced a lot of burnout in previous places of employment, had become overwhelmed with a lot of note writing responsibilities, She says that she's found a home now, and that this has allowed her to settle in, to become much more efficient, and to be able to do what it is that she does best, which is provide engagement and support for the clients. So in supervisions, I've been able to watch her grow and to become, someone who is now looking to go back to school and get further their education and everything else. It's just been a joy to behold.
That's great. And I'm just thinking, Kelly, you talked earlier about alerts, and I'm just wondering, have any of you had any experience? Like, do these systems actually help you avoid bad things? Like, do they tell you, like, oh my gosh, you should ask a question maybe about suicide or something? Is that the kind of thing that happens as well?
I can say for us, that's not currently a tool that we are using, but it's definitely on our radar. We want to be able to, right? Health records are giant document repositories. And so we're hoping over the next few years, we also see solutions that come in and kind of comb through all of that health record and put it front and center. Because if you have had a client in treatment for, a year or two, it's unrealistic to think you're going to remember everything you discussed up to a year ago. And so as these tools evolve, we're really looking to see how are you going to find ways that you can pull all this information front and center so that things don't fall out of that perspective. So then the clinician will be like, oh yeah, this has come up repeatedly over the last few years. And then they will know inherently, okay, I'm going to ask questions about this. And as well as diving directly into, we're all using suicide risk assessments and whatnot. And so how can we complement those screeners with information that's already in the system to be able to have conversations with information that might have just gotten buried in the record over the years?
Andrew or Jared, anything you want to add to that? Or
There's the different versions that you could use. With two of the three, it'll provide a directory or a group of keywords. So you'll be able to see kind of clusters of topics that the client might have discussed. And then that can provide, obviously, some insight. It's not necessarily, well, it won't in real time give you an alert. But looking back, as Callie was mentioning, it can provide some of that insight. And I think the other side of that is in terms of just that repository perspective. There's certain aspects of the AI that we use that will generate a recording of the session, and then there's others that it'll just listen. And once the note is completed, there won't be any record remaining of that. And if I just touch on that quickly, that's another one or another aspect that we've found beneficial in terms of any measure of client resistance or staff resistance, just having that variability. If someone had a question or a concern about a recording and kind of where does that go in the cloud or who else can access it and yada yada, the other version that's just a transcription and does not keep that record has been incredibly beneficial from an implementation standpoint.
Great. Well, you just touched on an interesting question that I was going to ask around staff resistance, or, I'm guessing maybe there was some anxiety beforehand, when this was introduced. And I don't know, does anybody want to comment? I've heard you all say that people have had pretty positive reactions, but I just wanted to explore that a little more. How has the organization responded?
We do staff satisfaction surveys, and they have shown a major reduction in employee-related stresses since the implementation of outreach. We have seen our staff attrition has been decreased as well. We were just having a conversation about that earlier today, that we're not having the open positions that we were posting as recently as 6-9 months ago. Things have improved across the board, and there's no happenstance or circumstance to that, or just coincidence. This has to be related. There's a definite correlation between the two. So there's better morale, there's improved relationships where people are able to say, hey, I can go back to school now. And we have performance bonuses that people have been able to obtain that they weren't before. So we're seeing market increases in morale and in general goodwill throughout the organization.
Callie or Andrew, anything you'd want to add based on your experience, Callie?
It's very natural to have concerns around this, and especially of late, we've seen a couple big instances in the media where artificial intelligence has gone really just completely sideways and had to be called back. And so for us, one of the things we've really focused is on that difference between artificial intelligence and augmented intelligence. We really are looking to make sure our staff understand we're looking for tools that will assist you. We're not looking for tools that are right. We're not looking for a robot behind the chair. We're not looking to automate positions. We are specifically looking for tools that provide value to your day to day. And I think those kind of educational pieces help kind of quell some of those concerns, just understanding, AI is an enormous spectrum, and we are right now kind of focused in this one specific area.
Thank you. Andrew, anything you want to say there?
Yes. So I think we've had the full spectrum of experience early on. There was resistance, within staff. We very early had to work hard at differentiating. Was it client resistance or was it staff resistance? So there were pockets of staff that were saying the clients have concerns, HIPAA, they don't want anything going back to their probation officer, their parole officer. But as we started to ask follow-up questions and really dig in, it wasn't clients, it was staff. Maybe, getting framed inaccurately but the clients, really what we've seen, much as you would expect, is if there was an adequate rapport, then they're gonna follow the counselor's discretion or suggestion. On the staff's perspective, early on there was some question or concern about whether or not this was going to get turned into a performance measurement tool, and were we going to judge them for their clinical capacity or how well they were engaging with clients. We have fought really, really hard to ensure under no circumstances did we ever use the AI in that capacity, and really everything that we possibly could do to avoid that misperception. And then we've also seen, just in terms of the ongoing, at times staff early on just being set in their ways. So, we mentioned it, but there's a lot of, maybe counselors who've been in the field for a while and they like to do things the way that they've always done things. And you introduce, this technology, and for all of the change that we encourage our clients to take on, sometimes we're not really interested in making a move. But 100%, I would say 90% or more, once the counselor is willing or able to try it, the experience is positive. It's really just a matter of kind of walking through that door and allowing for them to experience the benefit.
Yeah. So what are you guys thinking next? Like, this is kind of where you started. What do you think is next in terms of other uses or other opportunities?
We are doing a pilot project at a couple of our locations for using the AI software with group sessions. So we're still very early phases of it, but it's six counselors, 6 locations that we're currently piloting it. We're beginning to see some positive traction. The early on experience was pretty rough, bordering on unusable. But we are starting to see that kind of take hold. There's one it would be, I think, beyond transformational if we're able to make that work. We do a lot of group services. So, if you're able to take an individual session and cut down the documentation time, I mean, it's nothing for a large group to take 30, 35. It could be 45 minutes to do a note. If you could cut that in half, I mean, really, really exciting opportunities. Some of the big challenges is, of course, if you're doing an individual session, it's one person talking to another person. If you're in a group context, you could have 10, 11, 12 people in a room, much greater likelihood of crosstalk, or as someone's finishing a sentence, another individual is then starting the sentence. We still have telehealth involved in our service delivery. So we have hybrid groups where you might have half of the group is in person, the other half of the group is telehealth. Not every group room is built the same. So we're working out kind of acoustics and kind of how people, so there's a lot of variables that go into it. But we're really, really excited about it, and probably just as committed to figuring it out.
Wow, sounds exciting and challenging. Good luck. Callie or Darren, anything that you're thinking about, like what's the future?
Being on the south side of Chicago, working with people on the west side of Chicago as well, marginalized communities. One of the things that we're looking at is how you can increase the level of services, and not just at Trilogy, but throughout the city, throughout the country. There are a lot of people that are not able to access services because of, wide discrepancies in what's available. There are tools like Elios Outreach that allows people to cut down the time that they're spending doing documentation, which eventually allows more people to be able to provide more services. We do not have enough providers for the number of people who are suffering from trauma and from severe and persistent mental illnesses and addiction and all the other social ills that so frequently are discussed. So if we can, as an industry, begin to utilize some of these available tools to cut down documentation time and more efficiently provide services, you can increase the number of service providers. And so that's really the direction that we'd like to see things continue in so that we can do more for more.
We're looking for very similar things. And one of the things, Aurora, is an extremely diverse county. We have a large refugee population. And so one of the things we're looking at is how do we provide assistance when the services weren't necessarily provided in English, but our documentation has to be in English. And so we're starting a pilot now on how do we provide assistance on the writing of the documentation in English that relieves some of the burden of English as a second language that our staff and or our clients might experience. So we're excited to see if we can provide some tools in that arena also.
Wow, exciting. So I'm guessing you guys may have been involved with other technology or clinical change efforts in your agency. How would you compare your experience implementing AI to some of those? Like, on a scale of like ease, like how did it go? Maybe Callie, you were last. We'll have you go first this time.
Yeah, so I think probably usually the first thought when we suggest a technologically based solution is, oh, great, more work. And with this solution, there hasn't been a ton of extra work. There was extremely low bar to entry as far as learning. We were able to have one about 45-minute session to give an overview of how things work. And then outside of that, it was supported by office hours that were very low in attendance for the most part, which speaks to how easy it was to adopt this solution. And I think that is because the vendor has taken a lot of time to ensure they actually understand the users, the workflow, the impact. And a lot of times your solution isn't necessarily geared to a behavioral health population, right? the work that we do in this space. And so with this implementation, due to a very low bar for training, ease of use, and immediate return on the work you're spending to use this new tool, it's been, I don't want to say easier, right? I always say easy, and my team's like, it's not easy, but it's been much smoother than I would say some of our past implementations.
Andrew or Darren, anything you want to add?
The support that we receive has been phenomenal. It's been refreshing for, like, with the training, just to echo what Callie said. We'll have trainings, and my office is out here on the south side of Chicago, and our main training facility is all the way up north, and you have to go to trainings, and it's like an all-day thing to learn this new technology and everything else. But went to this training, it was like 25, 35 minutes, and instantly, oh, this is simple. And anytime that there's been any type of glitches in the system, because you're dealing with technology, you're going to have some things that don't always work properly 100% of the time. Just like AT&T had an outage last week that affected who knows how many different cell phone users. But the support has been there. They have immediately addressed any concerns, and as I said earlier, things have been progressing and getting better and better on a weekly basis. So that's been the key thing, is that the implementation went so smoothly. As Callie has said, who would have expected it to just be able to just step right in and instantly be able to see positive impact? So
Andrew, any other thoughts from you?
So yes, I wouldn't, I can't say, so your original question was kind of like rating it. And I don't think that I would say it's any more difficult than any other project. To Darren's comment, you know, the support, the technical support has been phenomenal. The capacity to kind of complete the trainings in an efficient and understandable manner is incredible. I think if there is a system that's evaluating moving forward with this, you just have to be honest with yourself about your current situation and bandwidth. So one quick example that I could offer, again, we have a number of different locations, all of them pretty variable, buildings, age, infrastructure, and we still run into internet connectivity. So you could have a program or even a counselor who's struggling with completing their notes or getting the transcription and everything kind of working together. And then what we end up finding out is their connection's not good enough in order for the process to take hold. But it takes time to get there. And then you kind of have to work with the counselor, because they might have heard, oh, this is such an easy thing and it works so great and it's so helpful. And their experience is, this thing, I can't figure it out. I'm doing everything right. It's not complicated. And you got like 5-6 people on an email to try and unwind it. So no, on its face, it is not anything extraordinary, but everybody's just got to be honest about what you're bringing to the table when you take the project on.
Yeah. And, this is not about any particular vendor, but just this particular kind of approach of using AI. Just a wild question: is there any turning back? Like, is this like is this going to continue to be your future?
For us, I would say 100, 1,000% yes. I mean, we regularly hear counselors say, "I don't know what I was doing for the past 5, 10, 15 years without this." I cannot see a world that we would go backwards.
Yeah, I agree. I mean, it's going to be a necessity of business going forward. To try to do these things without these tools is just not going to be feasible. And the big giant and in this conversation is, and also keep the brakes on. Also make sure you're watching what's happening and don't just blindly trust what's going on. Keep your eyes on the prize of we're trying to make things more effective and efficient, while simultaneously make sure you're poking holes and looking under the covers and making sure things are truly doing what you think they're doing.
Great. Thank you, Darren.
I I start a master's program in the fall. I can't imagine trying to work full time and go to school full time without having this tool available. I love Trilogy. They've been great to me. I I would probably say that I would be looking for someplace that would have something similar if Trilogy were to do away with this tool. It's been phenomenal, and it has allowed me to be able to do more, have more personal time and everything else, a better work-life balance. So I can't see us doing anything other than this. It has been so enriching for the whole organization. Just the retention, the morale, everything. I can't see a future without it.
Well, gosh, I so appreciate your insights today, sharing so much about your experience. Uh, for those of you who are interested in this topic, we're going to have a bunch of sessions at NatCon coming up in St. Louis, April 15th to 17th. You can participate in those. We're going to be kicking off some more learning sessions next year, and we'll really just continue to see how we can support both clinical effectiveness, access, staff satisfaction, clinic performance. What are all the potentials here? And Callie, we appreciate your admonition to go into it, with your eyes wide open, to do your homework. And it sounds like, I appreciate you taking the time to share your experiences with our audience. And audience, we so appreciate you being with us. Hope you found this conversation helpful, and we'll see you at the next edition of Wellbeing Wednesday. Thank you.